Hey everyone, Joss here. Today we're going to talk about addiction. There's a question I get often from a lot of people. Like people seek treatment, but they like to know if they actually have an addiction. So I wish it was just as easy or simple as asking you like how many drinks did you have this week, and then I'll let you know if you have a alcohol use disorder or not. But it's not that actually. It's quite complex, and it has much less to do with like the actual amount of how much you drink and much more to do with like how much problems are brought on by your drinking. Like everybody uses the term addiction except the psychiatrists. So in the DSM-5, which is more or less the dictionary of mental disorders, you don't see addiction. Instead, you see use disorder. So every substance or category of substance kind of has their own little spot. So you see alcohol use disorder, cocaine use disorder, cannabis use disorder. So they kind of have their little category in that sense. So to meet criteria, like what are the criteria for a substance use disorder? There's like 11 of them. So they're quite plentiful. The thing about them is that if you meet criteria for one, you're likely to meet criteria for a few other ones because you'll see it's all kind of interconnected in that way. So the first criteria for substance use disorder is do you often consume more or spend more time consuming than you intended? So the key word here is often. But if that happens, it kind of speaks to like a loss of control, and that's one of the criteria for substance use disorder. Next one is, do you have a desire to stop but yet you can't? That's another check mark. So at number 3, what we have is the component of time. In sense of like, do you spend increasingly large amount of time like getting the substance, using the substance, recovering from the substance? So basically, like if your substance use is starting to eat up into your schedule, if it starts to consume a lot of time from you, that's one of the criteria to say you have a substance use disorder. Fourth one is craving. So do you have strong urges or a big desire to consume? That'd be number 4. At number 5, we have, is your use linked with problems in your life? And by life, I mean like, is it causing you issues at work? Is it causing you issues with your friends, your partner, at your work, at your school? So is there a link between your use of a substance and issues into your life? Number 6 would be like, are you continuing to use even when there are problems there? So that's yet another one. So like I said, a lot of them are like kind of tied to the hips, and we'll see another one later on that ties with number 5 and 6. So at number 7, what we have is you gave up activities in order to consume more. So whether those activities be social, recreational, or occupational, if you start to give up things in order to consume more, that's a good sign that you may have a disorder. At number 8, we have using in situations that are hazardous or like dangerous. So if you think of like, maybe you've consumed and drove a vehicle, or you're at work using heavy equipment, and you're putting yourself or other people at risk. At number 9, that's the one I told you would like tie up with number 5 and 6. So at number 5, remember we had your use is causing you problems. Number 6, we had you continue to use despite those problems. And at number 9, we have you are basically aware and you have knowledge, and like you've came to that conclusion yourself that like your use is causing your problem, and yet you still cannot quit. That's another sign that you may have a disorder. And then we have 10 and 11. So at number 10, we have tolerance. So tolerance is just that principle of you get tougher to the substance. You either need more of it to achieve the same effect, or having the same amount just doesn't give you that same effect. So that's when you know that your body's starting to adapt to the substance, and that's a sign of like addiction. Finally, last one we have, number 11, is the withdrawals. So withdrawals is pretty much like that you've spent so much time with a substance in your body that you're having withdrawal from not having it. So you're having physical symptoms, psychological symptoms from not having a substance in your body. So that'd be a withdrawal symptom, and that would be the last criteria. So in order to have or to qualify for having a substance use disorder, you need at least 2 of those 11. But the way it's marked in the book, or the way it's like interpreted is that somebody can have a substance use disorder that's either mild, moderate, and severe. And for most of us, when we think of an addiction, we really think of a severe substance use disorder. There's many reasons why they like word it that way. It's just like more inclusive, and it speaks more to like, you know, you don't one day have an addiction. Like it's something that develops over time, and so for most people, they'll start with a mild, and then it's gonna escalate to a moderate, and finally it's gonna be a severe. Like very rarely do people just jump 2 feet into like severe substance use disorder. It's the kind of problem that usually takes some time, even if for some people it can actually happen pretty quickly. So all these tests to determine if somebody has a substance use disorder or not, unfortunately, you can't just draw blood and it's gonna tell you. Like you can do like physical tests like that, like blood sample or urine sample to see if they have the substance in their body, but that's not gonna tell you if they have like a substance use disorder with that substance. It just tells you if they used it recently enough that it would show on the test. So every test that you're going to do to determine if somebody has a substance use disorder or not, like you need to talk to them. And when you talk with people, you're at the mercy of what they choose to tell you, and at the mercy of their perspective, right? And so, you know, if I ask you, does your alcohol use cause you problems? It depends how you look at it, really. And so when we do those tests, we can't, it's not just a series of yes and no question, and we take your word for it. Like, oh, do you have craving? No? Oh, okay, perfect. Like, we don't just do that. We do, in addition to just like screen for the symptoms, there's a battery of tests that we can do. And we also do like a clinical interview where we dig into like history and past use and how it started and that kind of stuff too. So that gives us like a better read on the situation. Finally, if you use like standardized testing, like for example, I recently completed like my SASI certification. So SASI stands for Substance Abuse Subtle Screening Inventory. Substance Abuse Subtle Screening Inventory. So like what's particular about SASI is just that in their questionnaire, they have so many questions that they even have some that are almost like to vet your answers. Try to see as like the person answering this questionnaire, are they doing so earnestly or are they trying to like game the test a little bit? Because unfortunately, a lot of people, when they are ordered to do like testing to know more about their addiction, it might be like forced upon them, meaning like they may have had like a DUI and the judge orders a substance use assessment. And so some people come at it and they have an angle where they're hoping that the test will show a certain yes or a certain no result. And so it's nice that we have tools that can kind of screen that if you're being not genuine with your answers. But at the end of the day, like I like Gabor Mate's definition the most. You know, if you think about an addiction, what is it? It's something that you do that brings you comfort or pleasure in the moment. And you know that it will, in the long term, cause problems. Like you're aware of this, but yet you can't stop anyway, right? So it's temporary pleasure traded for long-term consequences. And that's when you start to think of an addiction. As it stands today, the DSM-5 only has one behavioral addiction, and that'd be gambling. Whereas, like we all know there's more behavioral addiction than just gambling. Like at this time, they're still looking into doing more research and more studies on it. But really, like, you can't tell me that people aren't addicted to their phone. You can't tell me that people aren't addicted to pornography or video games or whatever the case may be. Like we know that some behaviors are addictive, and it's often like the case with these types of books like DSM. They want to build enough research before they qualify a disorder. So that's why there's kind of a lag between like what most people are aware of and then what's actually in the book as far as like this is a disorder and this is not. You should know though that like internet use and like video gaming, like these types of things were not included as official disorders in the book, but there was pages that suggested like, you know, more research is required. So I'd be surprised if in DSM-6 we don't have anything at all about internet use or internet addiction, that type of stuff. So it's going to be interesting to know. But keep in mind, like if you're looking to know if you have an addiction, that there's plenty of tests online that you can do, like little screening here or there. The thing with all or most of these screenings though is that the bar is pretty low. Like most people are gonna, like if you drink a little bit, and by a little bit I mean like a couple times a week maybe, and maybe you get like a little bit drunk once a month or something, where you have like 6 drinks, let's say. That's gonna put you in like the high risk zone for substance use disorder. Like the guidelines for like safe drinking are so low. Recently, Health Canada came up, and where it used to be like a man could have up to 15 drinks per week and still be under like the high risk like criteria or whatnot. That went down to 2 per week. 2 per week is what Health Canada considers like safe alcohol consumption. That means that a lot of us are over that limit. And then it's like, okay, well, if you may have a very mild substance use disorder, is it an addiction? And that's where there's a lot of room for debate. At the end of the day, though, if you are concerned, if you feel like there's something you want to address and you haven't done so, there's it'd be to your advantage to try to work on yourself and get a grip on these types of issues, because unfortunately, like addiction is a progressive disease, meaning like it tends to not go away on its own, and it tends to creep up on you. So if you are dealing right now with a mild, moderate, or lightly severe substance use disorder, it's always better for you to do something about it right now. There's nothing that indicates that it's going to be easier to address this problem in a couple of years. So work on yourself and do what you think is best. And if you need some support, I'm sure there's plenty of services in your community. You guys should know that there is in New Brunswick, at least, or in Canada, we have like our Medicare that pays for a lot of mental health and addiction related services. But if you prefer not to have to deal with the government, you can go private. Private is either you can pay out of pocket, or perhaps you have like a insurance through work that could refund you a part of the service that you get. But certainly I encourage you, if you're considering, if you're debating, if you're unsure if whether or not you should get therapy, like try it out and see what comes of it. The goal is not for therapists to come in and tell you how you should live your life. Like that's really missing the point. The idea is more so to give you time to evaluate your life, try to see what aspect you're very happy with, which one you're not so happy with, and then help you determine like what can be done. What are you willing to do, and what can be done to help you improve your life? Thanks for watching. Hope this was interesting. And don't forget to like and subscribe. All right, take care.